So today we are going to study about rheumatoid arthritis. So main cause of rheumatoid arthritis is hypertrophy of synovial joint, the pathology is because of action of TNF alpha and T helper 1 cells. Major part is by TNF alpha. So there are 14 parts of the body which are involved. So let's see each one of them. First and the most commonly involved one is the upper limb. In the upper limb, the first deformity that we see is zigzag deformity. Okay, followed by piano key deformity, followed by subluxation of MCP. So these three are false deformities. Okay, so zigzag deformity is because of it manifests as radial deviation at wrist and ulnar deviation at MCP. The next one is piano key deformity, and piano key deformity is because of rupture of ECU tendon, extensor carpi ulnaris tendon. And the third one is subluxation of MCP. So moving on to the true deformities. The true deformity, the first one which appears is boutonniere deformity. So boutonniere deformity means there is flexion at PIP and extension at DIP. So if we picturize it, it'll be flexion at the PIP. So there'll be flexion. Suppose if this is PIP, there'll be flexion here, followed by extension. There'll be extension. It'll come upwards. This will be downwards. Okay, this is a finger. The opposite of this deformity will be appearing second, that is swan neck deformity. So in swan neck deformity, the opposite, that will be extension at PIP and flexion at DIP. So the next one is hitchhiker's deformity. Hitchhiker's deformity so when it occurs in acute condition, it's known as hitchhikers, and when it's just seen in chronic condition, we call it as gamekeeper's thumb. So hitchhiker's deformity is because of UCL of MCP joint. That is, ulnar collateral ligament of MCP joint is affected in hitchhiker's deformity. The next one which is seen is Vaughan-Jackson deformity, and that's because of rupture of third, fourth and fifth extensor tendons except extensor indicis. And the next deformity that we see is opera hand deformity. So that means there is shortening of the fingers. And one major deformity which we observe is mallet finger. So there will be, as we said, DIPs are not much involved in rheumatoid arthritis, but in mallet finger there will be hyperflexion at DIP. So these are the true deformities. So there will be 6 true deformities and 3 false deformities. The next commonly affected part is lower limb. In lower limb, the metatarsophalangeal joint is commonly involved. We can see this will be the first joint which will be affected, the metatarsophalangeal joint. And we can see pes planus, ankle valgus and forefoot varus. So this is also known as cock-up-2 deformity. The next part of the body which is affected is the TMJ, that is temporomandibular junction, followed by C1, C2. So when C1, C2 is affected, there will be cervical myelopathy and entrapment neuropathy. The next part which is affected is ocular. So in ocular manifestation, the most common one is dry eye, and the second most common condition which can be caused because of rheumatoid arthritis is Sjogren's. There can be manifestation of scleritis, which is not that common. It is seen in chronic rheumatoid arthritis, but even if scleritis or episcleritis, even conjunctivitis can happen, but never ever uveitis will never be seen in rheumatoid arthritis.